We're going to continue the skeletal system notes here and talk about bones that you're going to be responsible for in this class. So you will be responsible for recognizing the skull. It encloses the brain and involves its facial structures. The skull can be separated into the cranium and facial bones. There's lots of different bones in the skull, but we will not be memorizing any of them except for one. It has one freely moving joint, which is at the jaw where the mandible attaches. So you should be able to recognize the mandible, which is going to be this lower jawbone. The vertebral column is going to support the weight and supports weight and protects the spinal cord. It's made up of 26 irregular shaped bones. They're going to be your vertebrae. And there's different regions to these. Again, we're not memorizing them, but there are cervical, thoracic, and lumbar regions. You might hear about these when someone has a spinal injury. And these vertebrae are separated by intervertebral discs. The last one here is the thoracic or rib cage, which includes the sternum, the ribs, and the thoracic vertebrae. It protects the organs of the thoracic cavity, like your lungs and your heart. You will just be responsible for saying that this is the rib cage. Another view here of the ribs, the thoracic vertebrae, and the vertebral column as well. In the shoulder girdle, you have the clavicle, which is this bone here. When the clavicle is broken, the whole shoulder caves in medially, which shows how important of a bracing function it has for your body. It's also called your collarbone. I don't remember if I mentioned that. The scapula is your shoulder blade. You're sort of seeing it from the front here. So in the back is the scapula. The shoulder has lots of flexibility, but can also commonly be dislocated. So that's the shoulder girdle. In the upper limbs, in your arm, you have the humerus bone. It's a typical long bone at the top there. And in the forearm, you have the radius and ulna. So the radius is on the thumb side. So I'm going to sort of stand here. And so if I'm in anatomical position, you'll find that the radius is usually going to be on the outside and the ulna is going to be on the inside, which is my pinky side. Okay. So the radius is lateral when in anatomical position and the ulna is medial when in anatomical position, as a way to remember those. Continue with the upper limbs, and I'm going to X out of my video here so that you can see all of the bones. Bones of the hand are going to be, there's carpals, which are going to form the wrist bones. The metacarpals are going to form the palm of your hand here. And then you have phalanges, which are going to form your fingers. You will not need to memorize all of the different carpals, metacarpals, and phalanges. You just need to know where the carpals, metacarpals, and phalanges are. Okay. By the way, each hand contains 14 phalanges, 3 in each finger and 2 in your thumb. You can sort of imagine them being there when you look at your fingers, bending them. And you also, by the way, don't have bones in your knuckles. Those are the heads of your metacarpal bones. On your, when you make a fist, those knuckles that you have, those are the heads of the metacarpal bones. This is just a labeling activity if you wanted to do that. In the pelvic girdle, you should know the coxal bones, which are your hip bones. These are going to be large, heavy bones that are attached to the axial skeleton. They have sockets where the lower limbs are attached, as you can see here. It bears lots of weight, or they rather bear lots of weight as the two coxal bones there. The total upper body weight rests on the pelvis. So that's lots of weight. They also protect your reproductive organs, your bladder, your intestines. So lots of protection and support functions for your coxal bones. In your lower limbs, you have the thigh, which includes the femur, okay, which is again another typical long bone. Remember that your lower limbs carry all of your total body weight when you are erect, when you're standing. So the bones here are significantly thicker and stronger than bones in the upper regions. The femur is the heaviest and strongest bone in the body. In the lower leg, you have the tibia, which is your shin bone. It's larger and generally more medial. And then you have the fibula, which is thin and stick-like. The fibula is the distal end will actually form the lateral part of the ankle, right? So this distal end at the bottom will form the lateral portion of the ankle. The patella is the kneecap. It's not shown in the images here, but that is another bone of the lower limb. In your foot, you're gonna sort of feel a little deja vu here with the wrist bones. The foot is going to have tarsals, metatarsals, and phalanges. So the tarsals are going to form the posterior portion of your foot. The metatarsals are going to form sort of the sole of your foot, and the phalanges are going to form your toes. And then another labeling activity here.